All right, testing the audio, see if it's working. All right, let's rock and roll. All right, for everyone joining the live stream, welcome. You guys aren't at Spur, I'm at Spur. You might be in your classes and anywhere out in Colorado, so thank you for joining us. We'll be watching surgery here with the Denver Dumb Friends League. My name is Molly. I'm on the education team here at Spur. So a lot of my job is watching surgery and learning about surgery and learning about the Dumb Friends League. The room we are looking at right now is our surgery suite. So we have soft tissue that happens in this room. We will be zooming into kind of where that bright light is on the table. But first I'll give you a little overview of exactly what we're looking at. So this room, this does soft tissue surgery. So we do amputations, we do spays and neuters. If anyone has an animal who has like swallowed something they're not supposed to swallow, they will do what's called an abdominal explore and remove it in this room, as well as a lot of other surgeries that happen in there. So we're based in North Denver, but Dumb Friends League, they do have an animal shelter that's over on Quebec Street, so kind of like east-ish. But here is their urgent care center, so you can bring your animal in if they're not feeling well, if they need their teeth cleaned, they can come over to the Dumb Friends League here, and they'll check them out. Our view is kind of blocked right now by our light and dental, but you can also bring your animal to get their teeth cleaned here. We'll get an up-close view of dental in a little bit as well, but we have veterinarians, veterinarian technicians working on animals' teeth to get them cleaned, because dogs are really bad at brushing their own teeth. If anyone has a dog, you probably know that. So you can bring them here to get their teeth cleaned, get their teeth taken out, which has to happen sometimes. But they'll do a lot there to help out your pet's teeth, keep them healthy, keep their breath fresh. And we also have our cat enrichment room. In this room, we have adoptable senior cats, so cats without homes, who want homes, will stay here and hang out, and we can learn a lot about how to keep our cats healthy. So you can kind of see in the top of the screen, we have one of our educators, Katie. She is playing with our cat Halo. Let's see if we can get a better view of them. We'll see. We're gonna switch it around. So Halo loves to cuddle, which we'll see. Her and Katie cuddling kind of in that corner. She's a cuddly cat and she's available for adoption. She'll just really plop in your lap. But this room, it shows a lot of different ways that we can enrich our pet cats. So like dogs, we know we can play fetch, we can play tug of war with them, we can do a lot of fun games with dogs. But how do we enrich our cats? And really it's pretty similar. She has a lot of toys in there today, which we can take a look at a little bit later. But you can give them a lot of toys so they get to play, they get to practice doing cat stuff like hunting, stalking, behaviors cats really like, ways to scratch. Sometimes they have bird TV on, which is pretty sweet. But for today, Halo has a lot of puzzles that she gets to play with, which is very exciting. Right, those are our 3 rooms. We'll keep it on Katie and Halo for a little bit because we are going to be watching some surgery that's happening today. And before we get started, before they bring the animal out, we can expect to see some blood because it is surgery, so we are going to be cutting into an animal, but this animal is sick and needs help, so the surgery will help them. But we can expect to see some blood, to see some internal body parts, which I will talk us through what we're seeing and when. So I just want to give you all that warning, and if you're ever feeling uncomfortable, you're more than welcome to look away, to turn around, or just take a little bit of a break. And for teachers, educators, anyone watching, you can always exit out of the screen, minimize it, and rejoin with that link that was sent to you. If you also have any questions, there is a live chat that we'll be looking at. So if you have questions, feel welcome to ask them in the chat, and we can answer them for you about anything that's happening. I am going to switch over to our dental view. So what we'll look at is a dog getting their teeth cleaned. So this will be kind of our first view because they haven't quite brought our animal out yet. So with dental, a lot of the times, like I said earlier, and if anyone has a pet, you might know, it's really hard to brush their teeth. So animals need our help doing that. The animal we'll see when it switches over in a few seconds is under anesthesia. So they have the medicine. The dentist's head is a little bit in the way, so maybe we'll switch out. But they're under a medicine that blocks the signal from their body to their brain that says that they feel pain. That's what anesthesia does. It helps us not feel pain in a situation where it would be painful. And then in addition, they have medicine that helps them fall into a deep sleep. So this dog is essentially taking a really long nap. And then we'll wake up and have their teeth cleaned. Oh, that's not a great view either. But this dog will wake up. Sometimes animals in dental have to have their teeth removed because there's like too much plaque, too much tooth decay, a bad cavity. Dogs don't really get fillings, so they'll remove a tooth, which is fine. It looks like this dog might have had their teeth removed. And I know that because the doctor's going to lay some stitches in the dog's mouth. Right now, from my point of view, they're threading it up, and they'll do some sutures. You'll also see so they're under anesthesia, like I said. They have a breathing tube that will help them breathe during surgery. Like I said, the anesthesia and the medicine that helps them take that nap kind of slows their muscles down, and we use a muscle called our diaphragm to breathe. So the breathing tube helps keep that muscle working and moving so that our dog is getting oxygen. So it looks a little bit on the stream like the room the doctor's in is all black, but it's not. They've got lots of lights on. It's just the special light they use to get a good view. From our point of view, it has a camera in it. It makes it look a little bit darker, but really the room is nice and bright. This is just the perspective we have. And we'll switch over to our soft tissue suite in a moment. They're doing what's called prepping the room. So if you see in the surgical suite, the soft tissue suite, there are two tables. We'll be looking again at the one in the front with that big light shining on it, because that's where our camera is. or there are three actually, and then there's one in the back and another one behind that. So they could, if they wanted, they could have two surgeries happening at the same time. Today, I believe we'll just have one at the front table. So with these pets, most of them are owned. They have owners, and their owners bring them in and say, you know, something's up with my pet. They've been walking weird, or maybe I watched them eat something they shouldn't have eaten, or they're just acting kind of funny. Can you check my pet out? And they'll check them out, and they will determine the course of action. It's not always surgery. Sometimes they give them medicine. Sometimes they will operate like we're doing today. The person you can see walking around is our veterinarian in the room, so he'll do the operating, but he doesn't do it alone. There's a whole team in there. So they have veterinary technicians, they have assistants, sometimes students who have graduated from veterinary school and are starting their career as a vet surgeon will come here and help out and learn from our veterinarians, and it's a team effort in surgery. So we don't know, we're not quite sure what animal will come out on the table till it does. Like humans have HIPAA, which says you can't give personal information about patients. Animals have something similar, so we don't know this animal's name, we don't know how old they are. We can usually guess the breed just by looking, but that's a guess, so it might not be the most accurate. You can see at the bottom of your screen, it's like a turquoise greenish drape, I guess, over a little table with like a little package of the same color, and this is their sterile material. They're packaged up for the doctor to use, so they'll get clean, they'll get sterilized. You'll see before Dr. Martin starts, he will open it and each tool is individually wrapped, so that we know that the field is sterile, the tools are sterile, and this animal is going to be as safe as it can be. It's off camera, but I believe right now they are prepping our pet for surgery, and prep involves a few things. They will shave the area that's being operated on. So to get hair out of the way, to keep it clean, keep it sterile, they'll shave the area. They'll administer that anesthesia that I had mentioned earlier, the medicine that blocks the signal that something hurts to the brain, as well as, you know, help them fall asleep and take a nap during surgery. While they're prepping in here, we can switch over, see what Halo's doing. I don't know if I saw Katie leave the room, so she might be hanging out with Halo still. Yep. Looks like we're still hanging out with Halo. Yeah. And so this cat Halo is 4. She, again, you can adopt Halo. She was surrendered by her owner for a reason. We don't know what it is, and that's okay. Sometimes owners might surrender a pet. But we've got Katie hanging and playing with her. Alright, we'll hop back to dental, see what they're doing over there. Looks like our veterinarian is still laying stitches. Yeah. It looks like on this dog, maybe some lower teeth were removed. It's difficult to see. But, like I said earlier, there's a lot of plaque buildup that happens in animals' teeth, so it's very possible that there was just a lot and they had to remove the teeth. So something interesting that I can hear, but you guys cannot, is they're playing music in the operating room. So while we wait for surgery to start, you can think about, what would I play in the operating room to like really get me in the zone? You know, like what you want. Really intense music, soft music, music with no words. Sounds like the doctor and theirs are listening to some hip hop. So that's what gets him in the zone. We'll switch back to dental. Yeah, so this dog might be getting dental surgery for any reason. It probably came in for just a cleaning. Dogs and cats, get dental cleanings relatively frequently, maybe once or twice a year. A little different than, humans. We're brushing our teeth every day. But dogs will get cleanings, and with this one, like I said earlier, we don't know exactly what's happening with every case, but I imagine they had a cleaning. They noticed one of the teeth was really decayed, had a lot of plaque, was kind of beyond cleaning. They could clean it, but it wouldn't get that clean. So they decided to operate and remove the tooth. And it's kind of like when we get our teeth pulled, right? If anyone's gotten a tooth pulled at the dentist, the dentist can do it pretty quickly, but they will sew up the hole because, humans, if we get a tooth pulled, we can avoid irritating the area, but dogs and cats aren't so good at it. They want to start chomping and chewing right away. So they'll suture it to make sure that they can close that open wound so that the animal doesn't hurt themselves more, because when you remove the tooth, it is an open wound. And you can't quite see it in our view, but a lot of the tools in this dental suite, this dental room, look like it would for a human dentist, right? It has like the water tool, it has the little dental drill that you might feel sometimes and is not the most comfortable, the like picks for your teeth to get out that plaque. So a lot of the tools they use in here mimic human medicine, which I think is pretty neat. They have a handheld x-ray machine if anyone's ever got dental x-rays. they can do x-rays to see, you know, what's going on in the animal's mouth before they do anything, kind of like they do with our teeth. So this is a good view because we can see the tube to help the dog breathe, and we see his tongue is kind of sticking out, which might look a little silly, but we can learn a lot from a dog's tongue. When an animal or human is under anesthesia, we want to monitor what are called vitals. So our heart rate, our oxygen levels, we just want to make sure that while under anesthesia, everything in our bodies is working how it should. So they can use the tongue to determine that, actually, which is pretty neat, which is pretty crazy, because they will put a monitor on it. They can measure, you know, how fast the blood is flowing for heart rate. They can measure blood oxygen levels, all from using the dog's tongue. Another interesting thing that you might be able to see in this view or not is this dog has a lot of blankets on. In the operating rooms, the operating rooms are a little cooler than normal room temperature. Again, to keep it clean, to keep the area sterile, we keep it at a cooler temperature so nothing is tempted to grow, like a bacteria or something like that. But that means that it's chilly in there. So we use blankets to keep our patients warm, or heating, like heating packs, essentially. So this dog's got on a few blankets to keep it nice and warm and toasty while getting their teeth cleaned, and we'll see the same for soft tissue when they bring our patient out. So they're prepping our soft tissue patient, and the first procedure we'll watch today is called a spay. This procedure is done to remove the organs in a female mammal that help them have babies. So the uterus will be removed from the cat that comes out. And it's a pretty quick procedure. We have a clinic on the second floor of CSU Spur, which, if you've been here, you know what I'm talking about. If you haven't, you should come visit, so you know. But we have a clinic on the second floor that is dedicated entirely to spays and neuters. For mainly cats, but sometimes dogs. So all day, every day, they spay and neuter cats upstairs, and down here we'll be doing one, as well as what's called a pyometra, which we'll chat about. But with spays, they will remove the organ that helps a female cat have kittens, because kittens are cute, but there can be too many kittens, especially with feral or unowned animals. If we have a lot of kittens running around, there's a high risk for disease and just population control. So they're going to spay a cat here. Again, we don't know how old the cat is. You can, I think, spay a cat from very young to their whole life. And we'll watch that first, and then we'll watch a pyometra, which is actually an infection of that organ, of the uterus, where it gets infected, which can be very uncomfortable. It can be very unsafe for the animal. So when that infection occurs, they will remove it in the operating room. Yeah. Can see if we see Halo while we're waiting. Looks like she's having a snack. Just having a little snack there. Yeah. What's cool about CSU Spur is, if you come visit us, you can watch these surgeries happening live. This is something we have happen every day, and everyone can come watch. So you don't have to, you can come check us out on Monday through Friday, second Saturdays, during the National Western Stock Show. But now we just have Halo eating some snacks. In this view of Halo, you can see some of her puzzles that she uses. I have a cat at home, and they love that tower where you can, I don't know, they smack the ping pong balls and they run around the track. And it's one of their favorite toys, so this is a good way to see different toys you can get for your cat to help keep them active. Alright, and you can see it a little bit, but we have our veterinarian getting ready for surgery. He popped in and popped back out, but you might see he has on a surgical cap on his head to keep his hair from not falling on the patient. He's wearing a mask, and he'll wear gloves as well as a surgical gown. So they really work to keep this area clean, to help keep the patient safe. You'll also notice kind of at the top of the table, it looks like a white box on a cart. This is where they'll do some of that monitoring the vitals, like I was talking about in dental. They will monitor heart rate, pulse ox or blood oxygen levels, just to make sure that everything is going well with this animal. This is how humans and veterinary surgery, this is how we determine that the patient is doing okay while under anesthesia. Let's hop back to dental real quick. It looks like they're taking some x-rays over in dental, which is pretty cool. So if anyone's gotten dental x-rays before you bite down on that plastic chip, that is what's happening with this dog, but it's not plastic, but the hard x-ray chip. And so they're putting that in this dog's mouth, and she'll pick up a little handheld x-ray machine. Just to make sure, you know, if they removed a tooth, they want to be sure they got everything out. They want to be sure there's not anything up under there they need to remove, just to get a full view. Yeah, so that machine she's holding is the x-ray. So they're taking the x-rays. This center operates as an urgent care center, which means whatever comes in that day is the surgery we see. Most of them are not scheduled. Dental sometimes might be, but these will not be. All right, we have Dr. Martin, or our veterinarian, scrubbing in, getting ready. So he's got his gown on, his gloves, he's getting his clean tools up and ready. And we've got our patient on the table. This is a cat. Again, I don't know how old she is. I don't know her name. I just know it's a girl because we're spaying them, and that's a procedure only done on females. Yeah. And you can see at the bottom of the screen, our veterinarian is getting his tools from his, his sterile pack. Behind is a veterinary technician who's helping prep the animals, so getting their airway tube connected. They're going to do another really good cleaning of the area just because we like to be very, very clean, very stable in here. And we're going to get a close-up view now. Oh, yeah, you can see. And this animal is under anesthesia again, so they're not feeling any pain. They're also asleep. This will feel like a really nice long nap. And they're getting connected to that, again, that white machine that we'll monitor the vitals. So let's get a closer look. Oh, not much to see yet, but that's where the uprating will happen. We'll go back out. All right, let's get a closer view. There we go. So this is kind of like the operating field that we're looking at. This is where the surgeon will be cutting. So what you see these like blue kind of strings on their feet. That's just to make sure that there's, it's going to sound weird and I'll explain it, but that there's tension in the area. So they want to make sure the animal is not floppy so that they can get good clean cuts for the incision. Those wires again are monitoring their vitals, the heart rate. They're going to put a surgical drape over it again to keep the area clean. Dr. Martin's bringing his tools over, and this is going to be the first incision will happen, so there's going to be some surgical cutting. Just a warning. All right, Dr. Martin's kind of feeling the area to see where he wants to cut, and he's going to make the first incision with a very tiny blade from a scalpel. And spades are pretty quick. They're pretty good at these, and they go really quickly. He's cutting away some excess fat. That exists in all of our bodies. We have fat that keeps our organs nice and warm and protected. So removing fat that's in the way of the organ they're removing. And again, this is the surgery so that this cat cannot have any more kittens. They're removing the organ that allows that to happen. And you'll see this incision is not very big. They can do it from a really small point. So he's opening the incision, making the hole a little larger so that they can get their tools in. They'll take this hook and kind of just hook it around the uterus. Cat uteruses will look a little different from humans because they typically, their litters are larger than 2, which is kind of the amount of babies humans have. But cats usually have like 4 to 6 kittens, so their uteruses need to hold more. So he's using this hook. And again, going very gently, very slowly to ensure he's doing the right thing. All right. A big part of surgery is blood flow, right? We have blood flowing all over our bodies to help transport oxygen, as well as the cells that help fight off infection. So a big part of surgery is ensuring that the animal loses as little blood as possible. So sometimes those scissors that are holding there, called hemostats, will be used to close off a bloodstream or hold something in place before cutting, so that, you know, that blood supply is limited in where it can go, and then you can suture where the hemostat is. But quickly. A lot of hemostats because there's a lot of blood vessels. For cats and dogs, they'll have what's called uterine horns, which is what we're looking at. That V shape right there is both sides of the uterus. He'll clamp. It's like a very pronounced V. All right. So you'll see he's tying some knots, kind of cutting off some of that bloodstream and securing the space. And what's interesting about veterinary medicine and also medicine with humans, the stitches that they use most of the time are absorbable. So this animal doesn't have to come back, especially if it's an internal surgery. You know, you can't really go take the stitches out when the animal's healed. So these stitches will absorb in the body. They're made of a protein that our bodies, mammalian bodies, can break down. So if anyone watching has had surgery, think back and, you know, did you have to go back to get them removed, or did they just absorb? And if we were to use staples, which are for very large incisions or incision points that are a little not a clean straight line, they'll use staples. Oh, there you go. He tied off the blood supply and then separated the organ. His next step is going to be stitching up the incision, which again was pretty small. He didn't have to make it too large, but we're still going to suture to close, because we just don't want any infection. We don't want anything to get in there we don't want. And what's really neat about veterinary medicine is this cat will go home today. So animals are really good at healing their bodies and getting up and ready to go. She'll probably have a cone so she doesn't lick or kind of get at her suture point, because that may cause some infection. Yeah. And you'll notice he's going to suture in 2 layers. We have multiple layers from our outside skin to the internal organs. So he's going to suture both of those layers just to ensure a complete closure. So there was an internal, kind of that deeper level, and then this is the outer skin level. Yeah, so just finishing his sutures. Like I said, it's a really fast procedure. And I believe new is removing the male organ. Those are even quicker because it's an external organ that they would remove from a male compared to a female where it's internal. Here it is, removing all the tools, showing it off. And these tools will then go and get sanitized. There's going to be an injection. He's going to inject the site. Yeah, you can see in the lower left corner we have the 2 uterine horns. So he's going to give a quick injection to the site. So laying that final set of sutures. Yeah. And you can see he's using a hemostat and tweezers, forceps tweezers, to suture. Not using his hands to sew like we would, because again, we want to keep this as clean as possible. We want sterile tools whenever we do something new. And that needle, we talked about the suture material is absorbable, made out of a protein. And then the needle is curved to help kind of with ease of suturing, and also so we know that the pattern is neat and these sutures won't open. I've sewed in real life, and then I've tried suturing on the practice pad, and it's very difficult. So, it takes a lot of training and school to become a veterinarian. You'll do 4 years of undergrad, 4 years of vet school, usually a internship rotation. So for about 2 years. So you're after high school, 10 years of schooling. But we do also have our veterinary technicians, which is you can get a 2-year associates, or you can go to a special veterinary technician training program. So you can be in there, be in the OR helping the veterinarian out. All right, tying off his final knots there. and then he'll cut off the extra string so there's nothing hanging to get caught on anything or get scratched by the cat. There you go, put all of his tools away to go get cleaned. And then the final step of spaying and neutering is what he's doing now, which is putting on that tattoo that symbolizes I've been spayed or neutered. It's with a skin dye, so not like a tattoo machine that humans get tattoos with, but with a skin dye so that if this animal goes to another veterinarian or, you know, gets lost and someone takes it to a shelter, they know that this animal has had this surgery and doesn't have their uterus. And it's a little blue kind of marking. We'll zoom out, get a big look at the room. So you can see the table with all of his tools on it, kind of at the bottom. You can see our technician is disconnecting, so you can take this patient to recovery. Well, they'll wake up from anesthesia with, you know, we have this area that has like blankets and pillows, and it's so comfy and cozy so that when they wake up, they feel relaxed and they have people to take care of them, and then their owner will pick them up today. And since people can come watch surgery here, Dr. Martin, or our veterinarian, is putting the uterus on this little tray for people to view when they come to spur. Because as much as we like to show surgery, we want to show people, you know, what are we looking at? Kind of what we're doing right now. Yeah, so they're cleaning up the drape, untying our cat. Yep, just doing one of the important parts of surgery, which is cleaning. Again, sending everything so it can get sterilized, so it can get washed. They wipe down the surgical area again, just to make sure it's clean. Unhooking the tubes, and then they'll take her back to recovery. Here's another close-up for Kitty. You can see them unclipping all the monitors. And the monitors will stay out in the surgery suite for the next one. And again, she's sleepy under her anesthesia. And that was a spay procedure, pretty quick. We'll check on dental, see what's happening here with our tooth extraction. Again, we've got the vet's head in the way, but we won't tell her to move because she's doing her work. Maybe see what Halo's doing for a room cleanse. She's laying in her cat tree, hanging out. We usually have 2 cats in this cat enrichment room who have been stranded, but one got One was adopted, so we have Halo. She's got the whole room to herself. Living the life. We'll hop back to our surgery. This week looks like Dr. Martin's setting up for another surgery. So again, a fresh pack of materials. He's not reusing the ones from the first surgery. He's opening a sterile pack because it's a new animal, a new procedure. It might need new items. So he'll open his materials to prepare himself. We got about 1 minute left. So we'll pop back. So again, in soft tissue, looks like they're prepping for another surgery. Another one might have come in. An owner brought their animal. The schedule, like I mentioned, was pretty unpredictable. Dental, it looks like we're still working on that dog. Maybe some extractions, which is what we're seeing with, getting a tooth pulled. Might involve some blood. And finally, we'll check on Halo, hanging out in her room. And I believe, to jump back, that dog in dental is the one we've been seeing this whole time, so cleanings kind of take a while, which is okay. They want to be careful. They want to be safe. And then we have Halo enjoying her cat tree. Just living the life. All right. Well, thank you everyone for joining us. This was our first live stream, so I'm glad you could join us and, experience surgery and how it runs at CSU Spur every day. It's something different, something new, and we get to learn a lot about how to keep our pets healthy, how to help our pets, feel enriched, how to help them play, and what to do, if they need help. So thank you for joining. You guys have a great day. Come see us at CSU Spur. We have second Saturday this week on the 14th from 10 to 2. So you can come check out some special activities and watch some of these procedures yourselves because you're pros.